Interested in working on the front lines of healthcare? Consider becoming a licensed practical nurse. LPNs provide care for individuals, families, and groups. They work in many different healthcare settings, either alone or as part of a team. We talked to an LPN to find out more.
My name is Kathy Fuhrer, and I'm an LPN.
Did they say what the measurement was? Did you hear them say?
A LPN is a licensed practical nurse. We are a frontline professional nurse that does direct patient care. I always knew I wanted to be a nurse, and it didn't happen right out of high school as I first expected, but I chose as a second or third career rather to pursue my nursing dream, and I did it as a mature student. With my 3 kids raised and out of the house, I went back to school, and that's when I finally got to do what I wanted to do.
Morning.
I work 8-hour shifts, and I have done 12s before, but not currently. My first part of the day always involves coming extra early so I can start with a cup of coffee to get me going and make me feel ready. Then what I want to do is take a look at what my patient assignment is going to be for that day so that I can anticipate what I know is going to happen and plan, prepare, get my items ready and so on. I'll check the charts to make sure that the lab values are appropriate for the treatment they're getting. I'll look and see whether there's special isolation requirements that I need to plan ahead of time. I like to see what sorts of medications that I might need to look up in case I'm not familiar with them. And then I get that all ready out of the way, and then we have the time, and I'm somewhat organized so that the unanticipated things can be dealt with better. Typical days here don't exist, but what I do cover in a range of a week would include things like getting a blood transfusion happening and started. An LPN doesn't actually initiate the blood transfusion, but we're responsible for covering the rest of the aspects of it, monitoring the patients through that. I assist with procedures with doctors, and I work right side by side with them. We might be taking fluid off of a chest for people who are building up too much fluid, off the abdomen. So there's a lot of variety in what we do, but I'd say you're always teaching. Regardless of what it is you're doing with a patient that day, you're teaching them, you're helping them through the disease process, the system, how to get the help that you need. We're telling them about the different kinds of disciplines that are out there that they might not be aware of, that they can access, they can tap into to help their family get through this crisis.
Are you sitting high enough up?
An LPN can be employed in a variety of settings. I'm in what's called an acute care hospital environment, but LPNs are also engaged in work in nursing homes where they might even take more of a supervisory role over nursing attendants. They're involved in education. They're involved in private clinics as well as doctor's offices. LPNs go in home care. There's quite a variety of settings.
When we hired into the Crosshair for LPNs, we were looking for people who were highly motivated to learn new skills. We do get the LPNs to work within their scope to the highest degree of their scope, as reported by the College of Licensed Practical Nurses. We want staff members who are excited to learn. We want staff members who are up for a challenge and looking for new experiences and to get out there and help people.
Advancement opportunities would perhaps roll out more in a space where you might supervise over nursing attendants, depending on the practice setting. You might advance your practice by specializing. You can go into becoming an orthotech is what they call it, where you learn how to put a cast on a patient and how to cut those off. So very specialized to orthopedics. You can also take a program that allows you to work in the operating room, where you assist in there and you get things ready, and then you specialize just in that area. There are opportunities, of course, for you to expand your own knowledge and work into any particular specialization that exists within nursing. As a nurse, there has to be a balance, because when you're working with patients who are acutely ill, you can take home their sorrow, their burden, their disease. And when you do that, you burn out. So you have to be able to somewhat check it at the door and be able to go home and spend time in leisure that helps you maintain a healthy mind so that when you come back the next day, you're refreshed and you're better able to help that patient. I have so many things that I like to do in my spare time. There isn't enough hours. I like to garden, and I'm not very good at it, but I keep at it. Other people say it looks really lush and beautiful, but I'm of course a perfectionist, and I see what I still need to tweak and the things I'm not happy with, and I'm always rearranging where the plants need to be and what I picture. I keep planning the garden that I'm going to sit back and just enjoy, but I find that I'm enjoying working in it more than I am sitting back looking at it. I'm very happy that I decided to pursue that dream of mine to become an LPN. And what I find most satisfying about being a nurse is that it really did make a difference. It makes a difference to that one person, to that family. And if you chose to become an LPN, which I think is a darn good thing, be prepared, you will always then be a nurse. You have to be called to the job, and then you'll like it. If you're not, it won't fit. You have to be well suited, and when you are, it's the best thing you can do.
To become a licensed practical nurse, you'll need about 68 weeks of post-secondary studies. You'll also need to register with the College of Licensed Practical Nurses of Alberta.